I'm Dr. Michelle Grana, and I currently am practicing in Huntsville, Alabama. I have a few different specialties, one of which is holistic family practice, and now LDN treatment. A very wise friend of mine has been after me for a few years to start prescribing LDN for chronic pain. And I resisted this for two reasons. The primary one being that I am a holistic family practitioner. I'm not anti-pharmaceutical, I'm not anti-surgery, but they're not my go-tos. They are my last resorts. And the other one being I did not do my homework until recently. And I thought LDN was the latest trendy drug on the market because I hadn't heard anything about it other than my friend who kept hammering me over it. And no one else ever talked to me about it. And because I didn't do my homework, I didn't realize that LDN has been around for about 20 years. I am particularly adverse to prescribing new drugs to patients because I want to see what we may be setting them up for in the future. I want long-term studies before I put anyone on anything. And I thought that those studies did not exist. Well, as you already know from this amazing conference, I was very wrong about that. And as it happens, I wound up in a conference at Mr. Wingo's pharmacy on LDN. The observers were there in person, but the speakers were on pre-recorded video. There were 5 different doctors from 5 different fields, all of whom were talking about the amazing and far-reaching effects that LDN had on their patients. And I was so impressed. I had no idea. In my mind, at that point, LDN was for chronic pain. I had no idea that it is perhaps the holy grail of autoimmune disease. So after the conference was over, I spoke to Mr. Wingo and I said, I have some MS patients in my practice. Do you have any experience with this? And he said, yes. Well, we had a woman come in who had just had an MRI. She had MS. She had a new lesion in her brain. So we had her doctor put her on LDN, and 6 weeks, not 6 months, not 6 years, 6 weeks later, she had a follow-up MRI and that lesion was gone. It wasn't smaller, it was gone. So of course this piques my curiosity, right? I started researching everything I could. I found the LDN Research Trust, this amazing organization dedicated to, as you know, raising awareness of LDN, educating the public about the power of this generic and therefore inexpensive medication. And I read a number of studies, the oldest one of which was conducted before 2005. I believe that it started in 2004. It was done by Dr. Jill Smith, a gastroenterologist. She was studying Crohn's disease. And it was a pilot feasibility study for which showed very favorable results. She ultimately got funding to do a full-scale study, and in May of 2006 presented her results at a very well-respected gastroenterology conference. She followed it with a publication in the Journal of Gastroenterology on January 11th of 2007. I also discovered 2 MS studies prior to 2005, one conducted by Dr. Skip Lentz, 238 patients, 90% of whom reported either improvement or no decline in symptoms. Now, no decline in symptoms in MS patients is pretty impressive all by itself. 90% improvement or no decline. There was a second study on MS by Dr. I'm going to mispronounce her name, an Italian MD, PhD, neurologist, Dr. Giannani. I hate it when people mispronounce names, so please forgive me, doctor, who discovered that beta endorphin levels of patients on LDN decrease. Now, beta endorphins are proteins that are immunosuppressive in nature. So decreasing beta endorphins in anyone with an autoimmune disease is obviously significant. Studies that particularly touched me because back in the day when HIV was a fatal disease and not a chronic disease, I had many friends and colleagues who had HIV. I have a liberal arts background, and I personally cared for a family member for 6 months who ultimately died from a full-blown AIDS infection. And in Mali, there were 2 studies done on HIV. The first one showed that CD4 counts on LDN alone. Let me backtrack. CD4 is a marker for HIV infection. The lower your CD4 count gets, the sicker the patient is. CD4 counts were shown on demonstrated on patients taking LDN alone to remain constant. And the second study showed that when added with an antiretroviral drug such as AZT, CD4 counts significantly improved over a 6-month period. As a remarkable, remarkable result with LDN and another drug, that when AZT, those kinds of drugs, at least back in the day, they weren't demonstrably consistently effective in raising CD4 counts, but adding LDN, they were. So I became passionate about this drug. My friends and colleagues are quite amazed that I'm a believer in a pharmaceutical. Michelle, did you say that? Some audio issues. Can you hear me now? All right. I don't know where you lost me. Okay. So the first LDN is not a drug for acute pain. If you have a recent injury, it's not the drug to go to. Because of these audio issues, I don't know if Mr. Ringo covered that or not, but it is a remarkable drug for chronic pain. And I put my first patient on LDN for chronic pain. Now, according to the textbooks, LDN takes between 2 and 8 weeks to kick in. In medicine, we call that reaching a therapeutic index in your system. This patient started LDN on a Friday, and she woke up on Sunday feeling significantly better. Now, I hear the skeptics among you. I like skeptics, healthy skepticism. I'm one myself. Never take anything on faith. Make people prove it, okay? Healthy skepticism says, oh, that's the placebo effect. Since we have a little bit of extra time here, I'm going to digress briefly and tell you my personal opinion of the placebo effect. If I, as a licensed physician, can prescribe for you a sugar pill with no side effects, no contraindications, does not interfere with anything else that you eat, drink, or otherwise put into your body. It's impossible to overdose while you're using, and it costs a fraction of what pharmaceuticals cost, and it cures you. I don't know why every physician in the entire world isn't dancing with delight over this, because I am. I think that's the holy grail of medicine, not pharmaceuticals, because sugar pills obviously aren't pharmaceuticals. But I think that's the holy grail of medicine. If we can cure patients with sugar pills, why wouldn't we want to? All right, that's a discussion for another time. We'll come back to LDN. But this patient, whether or not she was suffering from the placebo effect, continued to improve, and she is today completely pain-free. The next patient I put LDN on was also for chronic pain. She had irritable bowel disease simultaneously. Interestingly to me, LDN helped her chronic pain, but worsened her IBD. When a patient takes a medication that has the exact opposite effect of what it's supposed to do, it's called having a paradoxical reaction. So I'm particularly fascinated by the fact that it helped her pain, but it made her IBD worse. So what did I do? I called my mentor and my muse, Mr. Wingo, and I said, what's going on with this? And as I did hear him address in his lecture, there are patients with gastric issues taking this medicine, and we have solutions to that. We have sublingual LDN, we have troches, which is what she ultimately went on. Troches, little packets that fit in your cheek, and they're dissolved through your cheek tissue directly into your bloodstream. Medicines that don't go through your GI tract have particularly beneficial effects. One of them being, because they're absorbed directly through the tissue into your bloodstream, they work much more quickly. Many people don't know that depending on your own physiology and on what it is you've eaten, from the time you put something in your mouth until you excrete it, can take anywhere from 24 to 36 hours. So when you swallow a drug, it goes through your GI tract, it takes much longer to be metabolized and thus start working than something that goes directly through your cheek or through your soft palate under your tongue. Another thing that perhaps Mr. Ringo addressed that I couldn't hear is called the first pass effect. Your liver's job is to detoxify things, right? So whenever you swallow a drug, 70, again, depending on your physiology, what the drug is, there's no cookie cutter medicine, there are no cookie cutter treatments, there are no cookie cutter patients. Everyone responds individually to everything. It's depending on you. When it goes through your liver after you've swallowed it, the potency of that substance is reduced 70, 80, 90% because your liver, if it's healthy, is doing its job. So when you take something through your cheek, under your tongue, or transdermally through your skin, you miss that. You skip that, what's called first pass effect, and you skip it. So we can consequently and happily dose in much smaller amounts with the same efficacy as we can when someone's swallowing a drug. I'm a believer in the least possible, the least effective dose that works for you. Less is more, right? As far as I'm concerned, I am a holistic practitioner after all. So my patient who used a troche started on 0.25 of a milligram, and she has continued on that effectively, which also cuts the cost down considerably. Although, as we've already discussed, it's a generic drug. So compared to pharmaceuticals that are still under patent, it's extremely affordable, particularly considering its far-reaching and powerful effects. So I am a believer in LDN. I will continue to happily prescribe it. I will continue to learn about it. I will support this wonderful organization. Mr. Ringo showed you that LDN book is being launched this fall, and I wish everyone the best. Please stay safe. Please wear your masks. That's how we're going to conquer COVID. Thank you. I won't pull out that soapbox here.